Good morning, Diana.
How are you, PJ?
I'm doing good. Yourself?
Great.
All right. Now, with the board members, are you going to bring them? Are you going to bring them over as panelists?
I know. I was wondering.
Hi, Diana.
Hey,
It's Debbie
Beth.
Quaid. I'm on. I'm gonna mute myself for now.
Okay. I don't. What do you think, PJ? I don't think so. I mean, I think just we have an agenda, so I'm just gonna stick to the agenda.
Yeah. So what we're going to do? Let's, if you can, just go over their names and then bring them over, promote them to a panelist.
I should just put everybody on panelists then.
Yes. Yes. Yeah. So that they have the ability to turn on their camera and unmute themselves.
Okay. Promote to panelists.
Yep. Only your board members.
I don't know who this Galaxy. Hold on. I don't know who that is. The Galaxy tab.
So if you can click unmute, maybe we can ask them.
I know this one. Okay. There you go. Let me ask them. Okay. Magnolia?
She's on mute. Hold on, let me unmute her. Press unmute to unmute. There you go.
Okay. So everybody can unmute. Magnolia.
Hi, good morning.
Hola.
We're here with Diana. Yes, I am here.
Okay. No. Okay, fine. No, because then she's gonna. So we're gonna wait until exactly 9:35 to start.
Okay. Do you want me to just leave the slate up? Leave the meeting slate up?
I have the agenda here. Should I just share my screen?
Yeah, let me just hold on one second. Yeah, you could do that as well.
Well, let me practice because I haven't shared screen.
Hi, Diana.
Hi.
Oh, it's hard to get you.
Are you Evelyn?
Yeah, I'm trying to get to.
Are
I
you
see you, but
Galaxy?
I can see you, but the screen is not blank.
Okay, hold on just a second.
Yeah. Good morning.
Diana, is that a board member as well?
Yeah. I'm gonna go ahead and move her now.
Okay.
Okay, Evelyn, you should be able now to do your video if you want. Evelyn, I lost her. Okay. Magnolia. Ilian. Más recuerda, just remember to mute yourself when you're not talking. if you can.
I don't know, the audio is not very good here. You sound very like,
Do you want me to do it? Okay, there. The connection is really bad, Magnolia. It's hard to hear you. Oh, I see Evelyn, sort of. Evelyn yes, right there. Ask to unmute.
Okay.
There, now we can hear you, Evelyn.
Okay,
Okay?
yes.
So, Evelyn, if it's okay, I'm gonna just run the meeting this time and then the next time you can run it. Is that okay?
Yes, that would be great. I have a lot of pain.
Okay, sorry to hear. Okay.
Yeah, not very good.
I told everyone we would start at 9:35, so if y'all wanna unmute, and then we'll get started at 9:35, okay?
It's okay. Thank you.
Ay, Dios mío. Hay que reírse. Apreté el micrófono y no sé cómo. Quiero silenciar el micrófono.
Hey, everyone, just to let y'all know, we're gonna get started like 9:35, just to give enough people time. But thank you all for being on time, actually ahead of time. Evelyn would be proud.
¿Qué onda, amiga?
¿Cómo estás?
Muy bien. Hey, Melina.
Hey, Melina.
Ahora me escuchan.
Perfectamente.
Sí.
I think I'm gonna have you go first, Melina, just so you don't, is that okay with you or
Sure, yeah. So you would just want me to explain what we're doing? Is that what you, okay.
for the
great.
salsa?
Okay. Yes, we're starting. Kevin is making coffee, guys. Sorry. Mira, saluda ahí. Saluda a Carolina, mira.
Kevin.
I want some coffee.
That's my husband, by the way. Nobody knows him. Es que the offices are right next to each other, so if he's talking and I'm talking, it's like, so I have to come to the kitchen.
Yeah, my husband's making coffee too, so you might hear.
¿Viste? Is it rainy over there? Yeah, it's super rainy here too. I have mine here too.
We're almost.
Espérate. Caro, ¿todavía tienes los globos de lo de David?
Todavía. No me los han dejado ponchar y él está loco por darle a... Pero no. María, no te, ni se te ocurra
Tan
tocar.
bonito.
Ya, sí. Súper, no.
Wow.
Pues, están duros.
Muchos.
Ya son. Que queden ahí.
Parece que estás en una fiesta.
Hi, Evelyn.
Evelyn. Oh, there's Evelyn right there.
Carolina, oh, there's.
Yes, ma'am.
Did you get a chance to talk to Natasha,
Yes.
Gabby? They're good?
Yes.
Because it's already 9:29 and they're not.
Let me call.
Just send them a little text.
Please stand by for 9:30 airtime.
Hi, Diana. Can you hear me? This is Enilda.
Yes, good morning.
Ah, okay. Good morning. Good morning. Hi, Melina. Hi, Carolina. Everything all right?
Hola, Nilda, tanto tiempo.
Sí. And Evelyn too, but I cannot see her now. I saw her before.
There's Oscar.
So Diana, do you want me to say like from like from the beginning what we want to do? Is that okay? So like have them see if they can help us out and stuff. Okay.
Yeah.
Okay, great.
PJ?
Yes.
Do I just get started at 9:35 and that's it?
Yep.
Okay. All righty. Let's go ahead and get started. I'm Diana Fontani. I'm the staff liaison to the Senior Affairs Committee meeting that we will now be meeting virtual due to COVID-19. Evelyn Cohen is the chair and she normally runs the meeting, but since this is the first time, she has delegated me to go ahead and run the meeting for her. And then next time she'll run it. So the first order of business is we have a guest here, Melina, and she's going to be explaining what Commissioner Gongora and her are going to be doing on October 3rd for the seniors and in conjunction with Seniors in Action as well. So go ahead. Oh, just a friendly reminder to mute yourself. And then if you have a question, I guess you can do the raise hand, or if you want to speak, just let me know. Okay, thank you.
Hi, good morning, everybody. First of all, it's great to see all of you, even on Zoom. I just want to say thanks for joining this morning and thank you for having me. I wanted to express, first of all, my gratefulness to all of you throughout all these years with my music and the events that I do, and also being able to go to your buildings and perform and everything. We are going to do something in conjunction with Commissioner Gongora. Also, Simply Healthcare has also helped us, Mr. Oscar and Mount Sinai. We are going to do a virtual concert. It's going to be like we used to have the Miami Beach Salsa Festival, you know, how we always used to have it every November. Well, this year, since we have COVID, we're going to be doing it virtual. And along with South Florida Seniors in Action, Carolina, that's there as well. We need your help to get everybody to connect we want to make it easy for all our seniors to be able to watch this free event for them. So we're trying to find a way to let all of our seniors know that this is a free event that they can watch from whatever smartphone or computer that they have at home, or from their phone. We're trying to show them how to connect to the event. So we're gonna do that by going to each building and giving some set amount of bags that have an instruction and the date, the time, and how to connect to the virtual event, okay, in Spanish and in English. I'm actually working today on finishing the sheet, the flyer that says how to connect to the virtual event. It's pretty simple. But I wanted to ask you guys what you think we should express in that sheet, because I'm finalizing it today. And I wanted to also ask you if you could let your seniors know, or your friends or seniors or buildings or however, that the event will be October 3rd, Saturday, October 3rd, 7:30 in the evening, okay, 7:30 p.m. And they just have to go to the web address that we give them so that they can watch this awesome event. We have dancers from all over the world that have done virtual performances and are sending them to us. And we're going to be showing them right before the live concert from the North Beach, from the Miami Beach Shell, the North Beach Shell. So it's going to be really amazing, and it's going to bring a lot of positive vibes for everybody. We're trying to do something positive for our seniors and our community like we always do. But it's harder this year because of the COVID. So we need your help in getting this moving, trying to get people to connect on that day. So that's basically, from today to the day of October 3rd, which is 2 weeks. We really need to get the word out for them to join. And we want them to be like a community where that concert is there. We're going to have people talking, and they can also, talk to us while the event is happening. So we want this to be a really nice joining point for everybody. Tito Puente Jr. is going to be there with us. The whole band is going to be there live, so they can see the music as it's happening on the stage. Yeah, so that's basically it. Want to thank Mr. Oscar that has helped us with Simply Healthcare and Mount Sinai, Diana and Carolina, that they have been amazing. South Florida Seniors in Action, to make this happen. I really wasn't going to do it this year because I didn't know how to do it. And the city of Miami Beach has been amazing, and you guys have been amazing to make it happen. Thank you, Diana, as well. So that's basically it. We just want everybody to get together and have a good time and have a positive night, because it's been very difficult for all of us. I'm sure for our seniors, 10 times more difficult this time. So that's really all I have. If you guys have any questions. Yeah. Yes.
I have a question, actually a comment. Collins Park Global Arts Project, for Collins Park, they used to do the live concerts. And so what they've started doing was holding them in the Women's Center and posting them on Facebook, which was huge for a lot of the seniors. I think know Facebook a whole lot better than Zoom. And if there's a way to have a flyer that can be posted to the neighborhood associations on Facebook, Collins Park, we had Tito Puente Jr. last week. And
I was there.
Oh, great. And so
Yeah.
the turnout is so much better on Facebook.
Right.
So, and
Yeah.
like I said, the neighborhood associations, any of these public, Michael Gongora's pages, if you give us a flyer, then we can start posting.
Right. That's going to be done today.
Okay.
And we will have, okay, so this is what I'm having a problem with, that maybe you guys can help me out. We have a Facebook page, which will be my Facebook page, that will be the one that
Okay.
everybody can watch it live on Facebook. So that will be on the flyer. The one thing that I'm having kind of like an issue trying to word is, how do I okay, so it's okay if I just put the link of Facebook and then the North Beach Bandshell address, because there's two ways to watch it. The North Beach Bandshell website, but the people that want to watch it on Facebook can watch it on my page. So
Okay.
what I was thinking is, I have the flyer already done, okay. with the flyer of the event that says everybody who's going to be there and everything, and all the sponsors. And then on the bottom, it'll have in English and in Spanish, like what the web addresses are. And I just want to make it easier for the seniors, the easiest possible for them to connect. So that's my question. Will it be easy for everybody to just connect more on Facebook or on the website? What is easier? I mean, I think some people don't have Facebook, so I'm thinking maybe both things.
You definitely need both.
Okay.
You definitely
yeah.
need
I
the option.
agree, Melina. I think you should include both of them on there. Sometimes a lot of people don't have Facebook, they don't have social media, so it'll be hard to log on. If you have a website, you can still view it on the website. If you send it to, most of us that are on this call right now, we pretty much have Facebook, or we have some part of social media that we can tag it and we can share it. So if you want to send it to us, that'll be beneficial to do that.
Right. Okay. So what I'm going to do is so the flyer that we have, the flyer, I don't know if you guys seen it, but it's a little flyer, has everybody's name on it. And then on the bottom, I'm going to say very big, how to connect, so that they know that it's, with those two links.
Okay.
Like if you have Facebook, you can log on to this link or my page, because a lot of people are on my page that we know. So they can just go on that link of my fan page. And then on the bottom, I'll just say, if you don't have Facebook, go to this link, which is the North Beach Bandshell page.
Do you have anything on the flyer that says watch it live? How to
I can-
connect to me is, it says, well, do I connect it anytime I feel like seeing it, or is it going to be recorded and then I can go look at it?
Okay,
So
so
watch it
it's,
live.
it's
Okay.
gonna be recorded, and the only
Okay.
way you can watch it again, not live, okay? So on that North Beach Bandshell page, it's gonna be live, but it's not gonna stay on that page. It'll
Okay.
stay on my Facebook page. So
Okay.
if people
Will it
want to,
Is it going to be on Facebook Live?
yes,
Okay.
it's gonna be Facebook Live. Okay, so
So
the
they can't
day
watch it
of,
live.
yeah, on the
Yeah, so
day of the event.
I'm asking, is the word live somewhere in the flyer so that they know?
No, that's a
what-
great idea. So I'm
Okay.
writing down all these ideas.
Good.
So, because I wanted to speak to you guys before I finish the flyer, because then we finish the flyer, we throw it out, and then it's like, okay, so I'm writing it down because
Okay.
today I'm gonna finalize it to send it to Diana so she can look at it and tell me her idea, if it, or whoever, if you guys want to look at it and let me know what you think once it's done, then, it's easier to just you guys look at it and then we can get going with it. So I'm going to say, watch it live. I thought that definitely. So the thing is that the event on October 3rd, it's going to be live, right? Afterwards, people can watch it again if they wish to watch it again, but it has to be on Facebook because the North Beach Bandshell is on to another thing. Okay. So then if they want to rewatch it, we can send them the link, but it's going to be on Facebook. So we can say, watch it here on this Facebook page.
Thank you for doing all this work. That's going to be awesome.
Yeah, no, we're super
Exciting.
excited. Thank you. No, it's really, I'm excited. I didn't think it was going to happen. And I'm so grateful to all of you because you guys have made it happen in like 0 time. Like, it's great. I want to thank the commissioner and it's going to be great. Mhm.
So go ahead and send us the flyer and then I'll send it to the committee. And we'll
Right.
do the deadline of like 5 p.m. today.
Yes.
If anybody has any suggestions.
So
And-
watch it live and then put the 2 links.
Yes.
So should I explain how to connect or do they know how to connect?
I think it's going to be too much if you start to explain it how to connect.
Yeah.
I think basically just saying you're going to watch it live on www.bandshell.com.
The 2 links or on Facebook or on this other link.
Right. And then, on Facebook Live, I think if you do provide the link for Facebook Live, isn't that going to be a long link?
No.
Please it's just a short link.
Okay. So this is what's going to happen. Just to make it more easier. We're just going to give the link to my Facebook page, which is Melina Salsa, facebook.com, Melina Salsa. That's it.
That's what okay.
Because then if there's no way for us to know what that link is going to be.
Right.
So on that day, if you click on my page, if that person joins the fan page, when I go live on that day, it'll say, okay, Melina's live now. It'll tell you like, oh, Melina has gone live. And then that's when the first thing that pops up in that page.
Well, you might want to put that in there to say, watch it live on Facebook, go to Melina's Facebook page, like it or join, my Facebook page. In order
or they can just go there. They don't have to join. They can watch it because it's a public page.
Okay.
So, but it'll be the first feed on that day at 7:30 on the dot. It'll be live.
Okay.
It'll be live. So if they don't want to join, that's fine. It's, but if you want like it to tell you I'm live, you have to join. So like if you want the page to say, okay, the event is live now.
Okay.
And I also have an event on Facebook that I created. So I'll share that with you guys. I created an event so that day it'll tell you like all the updates up to that event.
Okay.
If they want to join, it's really up to them. So I'll send you that as well.
All right. Well,
Thank you.
Melina. And it's going to be great.
Yes.
And then each of the coordinators or the representatives should, begin talking about this and telling their friends and the residents about it. And then we also will be posting these on all the, like the elevators and things like that in all the senior building. So thank you again, Melina.
Thank you, guys. I really appreciate it.
Thank you very much.
All right, back to the agenda. We do have some new members that are in the process of becoming officially members, but I asked them to join if possible. We have Maggie, is it Maggie?
Magui.
Magui Benitez from Federation Towers, and Gladys Navarro representing Council North. And we also have Sandy Alai. Sandy, are you on? Oh, there you are.
Hi.
She's the Division Director, Case Management Program at the Jewish Community Services. Did you want to just introduce yourself and say a few words?
Sure. Sorry, I'm at a hospital right now with my daughter's having a procedure, so I have to put the mask back on. Everything's good. It's okay. So, the Division Director for Jewish Community Services of South Florida. I oversee all the older adult case management programs. Our largest program is the Holocaust Survivor Assistance Program. We have many shared clients that live on Miami Beach, and I'm very thankful that I was invited to the committee.
Hi, Sandy.
Hi.
Well, welcome. I'll give you a little brief rundown after the meeting, but I feel like, we can do it another time too. All righty. So we have the next item on the agenda is the selection of the vice chair. Our chair is here. Where are you? You're there. Evelyn Cohen. And I don't know why we didn't choose a vice chair that same day, but we need to choose one according to the city clerk. So do I have any nominations for a vice chair?
Maybe Debbie?
I hear a nomination for Debbie.
Yes.
Or Oscar. I mean, there's so many of you that are they've done such a great job over the years. Who would like to do it?
Don't everybody speak at once. Okay.
I am more than happy to.
Okay,
However, if anyone does have a burning desire, then certainly speak up, please. But
I'll nominate Debbie. I'll second that motion.
thank you, Oscar.
Hi. The
I'm
same
always
thing.
reliable.
Okay. Debbie.
Thank you.
Okay.
All righty, so Debbie's our vice chair. Okay, moving on to the agenda, we have a hospital update by Oscar. Go ahead.
Hey, good morning, everyone. As most of you know, my name is Oscar Udente with Mount Sinai Medical Center. I know that we're talking to a lot of the case managers and social workers at the buildings here in Miami Beach, and I just wanted to give you guys a little bit of a hospital update for Mount Sinai, as well as what's going on in the community. And we're finding that a lot of the seniors, do not want to return to the hospital, not just Mount Sinai, but other hospitals as well. They are prolonging their health care, they're prolonging their doctor's visit, their procedure, waiting for the COVID period to lapse, for a better time. And what's happening is that they're coming to us or getting to us, and they're actually sicker, or in some cases something drastic has occurred. We're hearing from the fire rescue that when they get to the patient, the patient says, "No, I don't want to go. Don't take me. I refuse to go." And of course, there's no obligation for that rescue unit to bind the patient or tie them up on a gurney and take them to a hospital. The patient refuses to go, they don't have to go, believe it or not. They can check themselves out against medical advice. And what's happening is that then something really drastic, a stroke, a heart attack occurs. By the time they get to us, it's catastrophic. So we need your help to guide these patients, the seniors, and advise them if there is something that needs to be done. They should go ahead and have it done. They need to have their procedure. They can have their procedure. I will tell you, at Mount Sinai, we have 2 separate buildings. One building houses only COVID patients. And those patients, although we don't have a lot of them now because it's been decreasing, those patients are being seen by people, medical people that are only for COVID patients. So the staff that works with COVID patients do not work with other non-COVID patient staff. The staff that are the patients that are in the COVID building stay there. They have their own entrance, their own emergency room, their own ICU. They do not mix in with the other COVID patients. A lot of people used to complain about Mount Sinai being different buildings. This is one of the reasons that now it's actually good that we have multiple buildings so that we can keep the COVID patients in one area and the non-COVID in the new surgical tower. Okay, so that's number one. The most important issue is to let your patient know, no matter who the doctor is, if it's a Mount Sinai or if it's another hospital in the community, your patient should be seeing their physician. They should go to their procedure, follow their doctor's advice. And that's the update that I'd like to give you right now. If you guys have any questions, you could always reach out to me. If the patient, I am taking a lot of calls from patients out in the community. Some of you have reached out to me and said, listen, I have a patient that refuses to, or a senior that refuses to go to the hospital. They have a lot of questions. Please give them my cell phone number. Don't hesitate. Tell them to call me. I'll be more than happy to answer any of their questions. If they still don't want to come, that's fine, but we want to give them as much information and as much education as possible. And with that, I leave it back to Diana.
Oscar, what is your cell phone number? Can I ask that, Diana?
Absolutely.
Sure.
For everybody, it's 954-296-3951.
And if I'm telling someone to call you, I'm recommending they call you. What do I tell them your title is over at Mount Sinai?
Director of Network Development and Community Relations.
Okay. Thank you.
Cindy, I see your hand is up. Go ahead.
Yes, Oscar, as you know, we had one of the seniors that he's talking just about and have this situation. Several of them, Oscar, and I don't know what we can do here without offending anybody, but what I've been being told by several of the seniors is that they're being told, when someone has COVID in their building, another reason why you don't want to go to the hospital. Some tell me it's the police that are saying this, and some people are telling me that it's a fire that's saying this. I don't want to talk negatively about that, but my concern is they're saying, no. Oh, and don't go there to get your test because you're going to get it. There's many people in the hospital that have it. So you should just try to stay home. So my concern is they mean well, I'm sure, in their thoughts, but like Oscar said, then they're going to delay, other issues, other health issues. And it's very scary that, we're telling them that when, like Oscar mentioned, it's a separate building. Also at Jackson, it's the same setup. The hospitals are setting up different areas for the COVID to protect everyone.
So, Cindy, we've been hearing the same information, and that's why I came out and said about this. Quite frankly, I can't speak for other hospitals, but, it's just common sense. I can't believe that any hospital would jeopardize, a patient or a staff member and expose them to COVID by placing, a non-COVID patient next door to a COVID patient. I have spoken to hospital administrators, and they have separate COVID floors and everything. Now, I have seen on social media that, someone had posted, a family member posted that they went to go see their family, and then they passed, right next door to their family, there was a COVID patient. I just can't believe in my heart that a hospital would take that kind of risk. But there's so much misinformation out there. There's so many people talking, and the smallest little of misinformation is blown up to something that's catastrophic. And that's what's going on right now. That's what I believe is going on. That people are just getting the wrong impression, the wrong information. We're not here to expose anybody to COVID. No hospital's here to expose anybody to COVID. It's not just the patient, but it's also the staff that is putting themselves out there on the line. The other one with police and fire department, I still cannot believe that they're going to be saying something negative about them, because again, they're putting themselves on the line as well. They're getting exposed. And it's also a liability to them. If they say something negative and say, don't go to the hospital because you can risk running COVID, that's also a liability to them. And then they're not in the business to do that. They're in the business to help the patient. So again, that's what I am here for. And I'm pretty sure my colleagues at other hospitals are here for that as well. I mean, I can't give you their phone number, but if Cindy, if you know somebody at Jackson, if Jackson wants to come on, at any other hospital in the area, at UM, they want to come out and say the same thing and reassure the patient that it is safe to come back. Yes, we want them. One of the rules that we are still continuing is we're not allowing visitors into the hospital. And a lot of seniors, they find that really, not very good, because they want their family member to come by and visit them. But that's a procedure that we put in place so that, we're not exposing our staff and other patients to the virus. So unfortunately, at this time, Mount Sinai, we're not allowing any visitors. I know that other hospitals have just started very limited time, like you can visit your family member between 12 p.m. and 2 p.m. You only have a 2-hour window to come in. And that's fine for them. If they find that and they can control that risk, that's fine. We have sectioned off a lot of the hospital so that everybody who enters the hospital has, how Mount Sinai has multiple entrances. We only have limited entrances now, and everybody gets screened, including employees. Every time I walk into the hospital, I am screened. I have an app on my phone that asks me a list of questions. Have I been exposed to a COVID patient? Have I been, do I have a fever? The same questions that are given to patients and people coming in to see the doctor are given to the employees. And I'm pretty sure that's across the board with other organizations. Again, I can't speak for them, but I just know that in my heart, everybody's trying to do something really good and combat this COVID so that we can get back to a normal state of mind.
Thank you. Thank you, Oscar. Does anybody have any more questions for Oscar?
I do.
Yeah,
I just found the raise hand thing. Thank you. Oscar, what is the protocol? What happens when somebody says, yes, they have been exposed to someone with COVID?
If they have been exposed with COVID and now if they've been exposed to COVID, then they remain at home and they check their temperature, they check for symptoms. The only time that they would call 911 or go see a physician if they have, if they have cancer, if they have diabetes, high blood pressure, if they have.
When people go and you get those questions, and a lot of people have gone through that, and they say, have you been exposed to someone with COVID? If they want to keep their appointment, they're going to leaning towards saying no or lying. So if they say yes, is there a time, how many, because as time goes on, more and more people are going to be exposed to someone. And is the next question, how long ago was it? Or is there any kind of, do they say, no, you have to turn around and go home and wait 14 days for your appointment? I don't think anybody, I think people are afraid of the answer, so they're going to continue to lie.
Well, you know, I'd hate to say it's a lie, and you shouldn't lie, okay?
Well, no,
but you know what? When I answer the question, you know, I meet a lot of people constantly. So I don't know who has the virus and who does not. So my answer is, you know, but if you know somebody, if you're in a household and you're, you know, if your son or daughter or their friends come into and you know that they have COVID, you need to do the right thing.
Right. Okay.
Stay indoors and shelter in there for 14 days until you don't show any more signs of anything.
Okay.
And yes, you can actually call your doctor and say, listen, I've been exposed to COVID, just so that he can have a heads up, and I'm sheltered in place for 14 days. And that's the recommendation he's going to give you. Now, you know, again, if you have symptoms of COVID that are more drastic than just a fever, a cough, a body aches, you know, flu-like symptoms, then you know what? You can stay in and treat yourself. But if you have more drastic, that's when you need to be calling your doctor right away.
Okay.
Hi, this is Sandy. For our clients, we've been setting up the in-home testing. We go online and do it. You have to get right away at 9 a.m. to try to get an appointment instead of sending them out or they're afraid of calling their doctors themselves. We've been setting up the testings.
That's good.
I have a question about, well, now that she made me think about like the virtual phone calls for the seniors. Are they doing that? I mean, at least, do you know, Oscar, if
what virtual phone calls?
like
telemedicine?
To go see your doctor. Tele.
Yes, we are doing telehealth. We are encouraging, if you're not going to go see your doctor, you know, definitely do telehealth, especially for seniors that are more vulnerable. But I'm also, what I was actually talking about more are the procedures. So sometimes, you know, like Cindy had a patient that, or somebody that had, you know, something that was really, really drastic and that was going to get worse had she not gone into the hospital, but she had a big fear. I've had another gentleman that 911 called me because he didn't want to go to the hospital and he was having a series of strokes. Now he didn't, you know, he had small strokes, but you know, his vitals were so high that eventually it was going to turn to something more drastic. So they called me, we talked to him, we talked to the doctor, and we convinced him to come in.
Right, so you're talking more like the procedures.
Right, but you know what? If they want to come into the hospital, they can come into the hospital, they can see their doctor. The doctor's offices are not anywhere near a COVID unit. But, you know, we do encourage telemedicine.
Go ahead, Cindy, you have your hand up.
Oscar, another idea that I had for you is the ones that do have to go into the hospital for a procedure. What about, I don't know how the internet is wired at the hospital, but what about utilizing the TV in the room where a family member could maybe dial in and they could talk to the person via the TV? You know, if there's that, you know, where, for example, the person's lying in the bed, the senior's lying in the bed, and, you know, maybe they could have visitor hours certain times of the day and they could be, you know, talk through the TV if they're internet based, and they could, you know, maybe via Zoom or something, and the nurse could set it up. And then that way they're staying safe and they still get the connection. Because I think the fear is that, you know, from talking to many of them is, oh, well, people are not going to know when I'm there. And if I'm sick, I'm going to die or whatever. And I can't see my family. So, you know, I know that with people with COVID, they were using iPads in the beginning at certain hospitals to try to keep those connections. So why not use the TV in the room? Maybe investigate to see if internet could be attached to that and a Zoom app or something, and have visitor hours, like you said, but remote via the TV.
Okay, good point, Cindy. So we are using iPads, and we do encourage, when you come to the hospital, to bring your mobile device, either an iPad or an iPhone. Cindy, to convert the televisions to a video, I think that's going to be a lot of equipment and a lot of IT technology that's going to really, it's not for right now. Put it this way, it's not right now. But Mount Sinai, we do have iPads that we do give the patients. If they want to see their family member, we will dial them in. We hand the iPad to the patient. They can talk to them for an hour. But we do encourage the patient to bring in, if they have an iPad, a laptop. We do offer free Wi-Fi throughout the building, so they can log in if they want to. I've seen patients that had logged into their family member for 2 or 3 hours that look at the kids playing and all that stuff. So we do encourage that, absolutely, and our staff will definitely help with that.
Thanks, Oscar. That's good to hear. Because, and again, a lot of the buildings, the senior buildings, a lot of them just have basic phones. Some of them are not internet. They don't have internet access or an iPad. So it's good to know that you're offering that, because then that way they can get the connection, which is critically needed.
And let me tell you, sometimes I've even heard our own staff will give them their own phone for a little bit and talk to their, if they don't bring in a phone with them or something like that. I've heard some of our nurses, use their own phones. So.
Thank you, Oscar, for that update. Moving along to the next item on the agenda is community services update. Alba, are you there? From community service?
Yes, I am. Hi. Hello.
So go ahead and just give us an update of what the senior community is available for now, or what services y'all are providing now during this time.
So a little bit about what our office does. We provide, we serve youth, families, and elders, and anyone that is in need of help. So a little bit about what we do is we have an Access Center assistance, which includes assistance for SNAP benefits, food stamps registration, TANF, Medicaid, online application, etc. And so with the whole COVID situation, things have obviously changed a little bit, but we continue to provide the service, and we do that with appointments. So before, where we had the walk-in center where anyone could come to our 555 building and we could provide assistance, now it's a little bit different because we have to make sure that you have an appointment first. And it's really easy to get an appointment. You just have to call our number, 305-673-7491, and we can schedule an appointment right away to assist with benefits. If not, the alternative is you can call our office. Let's say if you want to do online registration for food stamps, etc., we can assist you through the steps online if needed as well. Another assistance that we provide is during tax season. We provide tax preparation. And in this last year, we did 429 tax returns. And these are all free of charge. So that's really important. We also provide home-based services. So we do sort of wellness checks when we hear from the community that maybe something is going on with a elderly in our community that maybe needs to get tied into different referral services. We do a home visit where we go out, obviously with an appointment first. And now with COVID-19, we make sure that we keep our face shields and face masks, etc. We also work very closely with all of the senior buildings. We provide resources when available. We actually have someone on staff, Daniela Tamayo, that keeps in contact with all of the senior buildings and the senior staff to make sure that, for example, when masks become available, that they have the opportunity to get them and get distributed. When different opportunities come into play, we make sure to keep them informed. We also provide rent and utility assistance when needed. We did that before through EFSP, which is the Emergency Food and Shelter Program. But now, due to the situation, we have expanded that with federal programming to assist community individuals that have found themselves impacted by COVID. Another really unique thing that our department does is we have, through the Community Development Block Grant, we have the grocery delivery program where we assist 96 elderly households with food assistance every month. And right now that program actually got expanded from 50 when it originally started back in about 2015 to now being able to serve 96 households. And even though there's a current wait list right now, we try to move it along as best as we can and try whenever there's availability to be able to expand the program. Another unique thing that has happened with COVID-19 is our department has also started the food pantry program for individuals that have been impacted specifically by COVID-19 financially, and maybe they've become food insecure. That's also something that I wanted to add on the grocery delivery program. One of the criteria is that the household has to be food insecure. And what that means is that with the amount of benefits that they receive, the food piece would be something that they wouldn't be able to pay for. And for us, again, our elder services, we have a lot of connection with the Alliance for Aging. We can assist through the state attorney's office, even though sometimes for benefits and certain things like that. And I know I had sent over to Diana this morning a little bit, a flyer in English and Spanish of what our offices does. And so I'll be more than happy to provide that. And we have a really quick flyer too, because that one is a little bit lengthy because it shows exactly what all of our services are. So I know it could be a lot, but we have sort of a briefer flyer. It's a little bit about us in the short version, condensed version.
Okay, thank you. Yeah, I'll get that flyer to all the members today so they can distribute that or to their buildings. Any questions for Alba?
Hi, Alba, Debbie Quaid. What is the official title of your department?
The official title of our department is a mouthful. It's the Office of Housing and Community Services.
Okay.
Yes.
And phone number?
305-673-7491.
Okay, thank you.
Of course.
Any other questions for Alba? Okay, well, thank you so much, Alba. Thank you for all the hard work y'all are doing. I know y'all department has been.
We've been busy, but we're here for the community. So again, anything that you may need, even if maybe I may have skipped it over, we provide referrals to everything and anything you can imagine. And our office is really just here to serve in whatever we can.
Thank you, Alba.
Thank you.
Okay, moving on, discussion of each senior center. Do we have somebody from Council Towers South? She's on.
Natasha.
Yeah, she was here earlier. I saw her and I moved her to panelist, but I don't know what happened. Maybe she can get back on if somebody can text her. In Council Towers North, I know we're gonna have the new member joining us next time. Four Freedoms.
That's me, Enilda.
Just go ahead and tell us, how's everything going with COVID and anything that you need from from the committee that you can think of. Okay.
Okay. Here at For Freedoms, we are going through a renovation of the building. So during this pandemic, it's something very difficult, right? But I think everything is going okay. They took the necessary measures to have all the residents safe. Okay, so we didn't have very, very few cases of COVID. but everything is all right. Okay. I don't know if you can hear the noise, but they are working.
I was
Okay.
just about to ask you about I know that it's under construction.
Yes. Yeah.
How is that going?
That's okay. That's all right. They are doing little by little because of the problem of the pandemic, but everything is all right. Everything's going on.
Okay, that's good to hear. Moving on to Federation. I believe that's our other new member that will be joining us next time. Rebecca Towers. Can you unmute yourself, Ileana? I'll ask her to unmute. Guess we'll go back to her. Stella Maris, Gabby, are you there?
Hola.
Hi. Can you go ahead and give us an update on Stella Maris and how everything's going with?
All right. Everybody, a todos. Today I have surprise because a company came to my home, start to fix it, the ceiling, and then I have to get out, and it's very difficult now to connect with you. But whatever, about Stella Maris, everything looks okay. Months ago, they made a test of coronavirus, but the results were private. Nobody knows, nothing. But looks okay. All the activities are any activities. But I would like to suggest, I know in some buildings, specifically in Stella Maris, there are area outside. I don't know why then it will be possible to do some activities, exercise maybe. It will be possible to support somebody to give classes. I don't know. It's my question.
I don't know. I mean, I guess I don't think the city can, allow for groups to conjugate, especially like the senior community that's the most vulnerable during this time. So I don't anticipate that the city would do that, in my opinion. I mean, I could always ask, but
because coronavirus, there are many ways to fight it with it. One of these is to be in good mood, and then the people look so sad.
Yeah, well, I think I don't know if you were on in the beginning, but we are doing the virtual salsa with Melina on October 3rd.
Oh, okay, that's nice.
Like those types of events, or I'm sure we could organize maybe a virtual exercise, but I know it's hard for the seniors to connect sometimes. So
yeah, but Miami has a lot of parks. We can use the parks, and the parks, especially in the morning, the children are in the school, and the daily people can use it for free outside.
Yeah.
No, thinking about that.
No. I mean, I'll keep that in mind, and we'll I'll discuss that with the powers that be. But for right now, we are doing that virtual salsa event that I think is going to be good for the morale of the seniors, and so hopefully that'll boost their morale, because yes, I understand what you're saying is that to be healthy and active during this time.
Yeah.
It does get,
Everybody gain weight. Everybody gain weight. And then we need to move to breathe, to see, to be outside, but in the most security, in distance, whatever. But the people have to start to recover their usually activities. This is very important.
I agree. No, I totally agree with you that, what you're saying. Well, thank you. Anything else from Stella Morris?
That's fine.
Okay. So anybody else have anything for the good of the order to bring up?
Diana,
Yes.
I need a favor, Enilda.
Yes.
We tried many times to reach your building to bring the food, but it's impossible.
Why?
I don't know what happened. Maybe it's possible you talk to Estrella.
Oh, okay. Well, yes, I can talk to her. Yeah.
Thank you.
So she doesn't reply to you. What happened? She never.
She's saying no.
You're trying to reach her?
I try many times. Okay, so she's saying no, and at this moment it's a lot of work, but the political parties go to the building, and it's I don't know.
Okay, and what's your suggestion? Well, you bring the food and give to the seniors downstairs and in the street. What's your? How do you manage?
Whatever Estrella say, so it's fine.
Okay.
Okay.
All right.
Thank you, honey. Thank you.
I'll talk to her. Okay. You're welcome. Oh, Diana, I sent a text to Natasha. And she said that she cannot connect to the, at first it was okay, but then she doesn't know, he doesn't know how to handle this well. Maybe next time.
Yeah, for sure. Next time I'll help her. I'll call her now.
Yeah.
But obviously, yeah. But yeah, moving forward, speaking of, I think this is the way that we're gonna have to meet probably for the near future. So yeah, so I'll make sure that Natasha becomes
okay. When I'm at the office, I'll try to help her, to show her how this works, and probably next time with your help too, she can connect. Okay.
Thank you.
You're welcome.
Anybody else have anything? Any suggestions for the next meeting? Which departments y'all want to come and present? I know Cindy had suggested transportation this time, but oh, there you go, hand up. Go ahead, Cindy.
Now, I'll go ahead and give the update that I have, Diana, from parking, from the meeting from earlier this month. Milos had talked from transportation, he and Jose, about resuming trolley service in October. I explained to them what I know, and again, the other seniors can chime in on the call, is what I'm being told from Rebecca Towers and some of the nearby buildings south of Fifth, is that people are using the bus, because of the social distancing, and depending on the size of the bus, primarily the 120, the S, the M, and the C, they're using it with social distancing to get around because the trolley is not running. The idea that they have is to run half of the trolleys. And again, the capacity of a trolley is usually 24 people. It will be about 12, but what they're doing, the ideas I had presented to them, and please let me know if there's anything that you would like to see, is that they're going to run them to core places such as Publix, Mount Sinai, 41st Street, where there's a lot of doctors. That's what we discussed is core places, Lincoln Road, places that people really need to get to. They will not be running the whole entire circuit of the trolleys right now because of the funds that are not available. But I wanted to get feedback from the seniors on the call, Diana, so I can report back to Milos. He would like to come to a future call as well before he starts something. Again, they're thinking of doing it. It's not for sure yet.
Yes,
so I'd love to hear feedback from the group if you don't mind, so I can let Milos know, because do they want it? Do they not want it? Also, Diana, he had also talked, did they like the freebie where it was outside? I noticed, for example, we had it 2 days a week, for example, here at Rebecca, and they got it for 2 to 4 hours to go to Publix and to go nearby to pick up things. Is that helpful? Would they prefer that because it's an outdoor vehicle and you can more socially safely distance? That's it. That's my notes from the call.
Yes, I spoke to Jose Gonzalez, the Director of Transportation, last week, and he suggested that they come in October when they have something more concrete to present. So they'll be here in October for our October meeting.
Okay, so he's not going to start it in October? Because that's what they told us on the call. They plan on starting it mid-October.
But was the call before the commission meeting? Because the item was deferred, I believe, at the commission meeting. Our
call was on the 12th. Sorry, our call was on the 14th.
Yeah, the commission meeting was on the 16th and it was deferred till October. So I don't think they're going to make any decisions until then, but I'll double check.
Okay. I just think that they should definitely have the input from us and from the seniors, because if they're wanting to start this, for them, we should try to find out what they need before we just start throwing things out there. That's what I explained to them, because I know that right before they shut it down earlier this year, a lot of them were not getting on because of the lack of sanitation. Now, again, they brought that up too, that there would be wipes and everything available and that would be wiped down and everything. So that was brought up too. So I just told them it needed to come here before they did anything, in my opinion.
Correct. I mean, I know, I wish there was a way to do like a survey or something. Does anybody have any suggestions? Oh, Oscar has your hand up. Go ahead, Oscar.
Well, I have a suggestion. The best way to do it is probably through SurveyMonkey, especially online. But I actually don't have my hand up for that. I have my hand up for something else. So when you're ready, I do have an announcement.
I know. I thought of that too. Like the SurveyMonkey is what they do at my daughter's school for input. Do you think that would work with the seniors?
No. A lot of them don't have internet. They can't afford it. They have a basic phone. They have a phone that they can text and that they can use, make calls. Some, the more savvy ones, have internet on their phone and they have Facebook set up, but not a whole lot. I feel that when we've been successful on things, it's been done by paper. And I don't know how we would do that unless, they put them on their door and they collected them. Maybe that would be allowed since it's a city initiative. I think putting it on a door and then maybe getting collected, maybe a box downstairs. They could put them on their door and put paper and have, I hate to, use paper, but I think it's just going to be what they know and what they're comfortable with. That's just my opinion.
Okay. Well, I'll get with the coordinators and see. I don't know about the paper thing, but I get you that not a lot of them have the internet. All right, well, let's move on to Oscar. You had something?
Yes, I totally forgot. I wanted to make an announcement that this is a good webinar that's going to be happening on Wednesday through the Alliance for the Alliance for Aging. It's called the New Face of Aging. There's going to be some speakers. It's a free event now. I mean, usually it's a paid event. It takes place every year at Parajungle Island, but because of this year, it's taking place virtually. Like I said, they will have a keynote speaker. Her name is Louise Anderson, Aronson, MD. She's a geriatrician and a professor of medicine in California. She's going to be giving an update of aging in a COVID time. So Diana, I'll send you the information, and if you can disseminate it to everybody, you can log in, you can see it. There's going to be an expo hall, just like what we usually do at Parajungle Island, but instead of being live, it is going to be virtual. But I'll have an expo table, and I will be on my expo table live. So if somebody wants to log in, they can talk to me one-on-one at any time. So I'll send it to you right now.
Great, that sounds great. Anybody else have anything to suggest to the commission? Nothing? Anyone? Okay. Well, it was good to virtually see everybody. I think let's just go ahead and check our next meeting. I believe is already on the calendar for October 26th.
Yes.
That's correct. That's correct. That's the last Monday.
Yes.
So again, we'll be meeting virtually, and then and then I'll be sending the flyer out today. So don't forget the salsa flyer to review. So if you have any suggestions, when she sends that over to me, for y'all to review that as well. Anything else?
No.
No.
Okay.
You will, excuse me, Diana, you will send the information by mail?
Yes. It's the virtual
flyers to the building. How are you going to do?
So the virtual salsa event, she's just going to send us a draft of the invitation and how to log on. And so she wanted our suggestions, to make it easier for the seniors to log on. So she's going to send that today, and then we're going to finalize it. And then once we finalize it, I will be distributing to the senior centers as well.
Well, I would like to share one activity. Do you know Monica Torres gave flamenco classes, and then we start in Flamingo Park one time a week, every Tuesday at 10:30. Anybody who wants could be there. The first class was the last week, very interesting, and everybody keep the distance, the mask, and they brought a chair. Everybody carried their chair, but it was so nice, really so nice. I hope so we start another activities pretty soon.
Yeah, if you want to send me an email with the information, I'll share that with the group as well.
All right. Okay, I will.
Great. I did have also another one announcement by, she couldn't be here. The Hispanic Heritage Awards is going to be on Tuesday, October 13th at 6 p.m. via Zoom. So when they send the link and the invitation, I'll send it to you guys. So that's the Hispanic Heritage Awards, Tuesday, October 13th at 6 p.m. So but be on the lookout for that as well from me. Okay. Well, I thought this was very productive. Good to see everybody again virtually.
Thank you.
Hey, everyone. Miss you. Bye.
Bye.
Bye.